unmute your mic now.
Hello.
Yes, Dr. Denis.
Yes, yes. Good evening.
Good evening.
Thank you very much for the nice presentation. Mine is just additional to what you presented.
Okay.
Cardiac rehabilitation, as you have said, is underutilized in mostly in low and middle income country, especially in Africa.
What did you say?
Hello.
Sorry, what did you say? Pardon.
This is just additional from what you presented. It's not actually the question. Hello.
We can hear you, Denis. You continue.
Okay. This is just additional from the presentation. Cardiac rehabilitation actually is true, is underutilized. So sometimes I don't know how many centers we have in Africa, but it's a delicate topic. Is need a lot of assessment before we entering. Before the discharge, we can start the patient from the inpatient, making follow-up to outpatient. But what we need is first the thorough assessment. We have to check the hemodynamically. If the patient is hemodynamically stable, so there where we start. We check the blood pressure, the vitals, the saturation, all of this. Then this patient, when he or she is stable, then they are planning for discharge. Then we can do some tests, the outcome to check the functional capacities. So we follow up the patient inpatient, post discharge. Before going home, we can decide if we have a center-based rehabilitation or home-based rehabilitation. Then we have the option to choose. If we have a center rehabilitation, before discharge, maybe from ICU, from general ward, we have to make some tests. A very simple test is a 6 minutes walking test. So we can know the strength and the capacity of our patient. Then from there, we can start our prescription of exercise. From there, we know the capacity of the patient. Now we channel him or her to a center-based cardiac rehab or home-based cardiac rehab. Then from there, we can start from the reference of 6 minutes walking test, how much distance a patient can cover. So if we prescribe an aerobic exercise, that will be our reference. Maybe let's say our patient post-discharge cover 150 meters. Then during our aerobic exercise, the type of exercise using the PT principle, frequency, intensity, time and time. So all of this in rehab, any type of rehab, we have to follow this principle as the physiotherapist. So after knowing how much distance our patient can cover, hemodynamically stable, the saturation is stable, blood pressure is stable. So from there we can prescribe our exercise using PT principle. For example, aerobic walking exercise. Maybe the patient post-discharge covered 150 meters. So from there where we'll start, our patient ability functionally is 150 meters post-discharge. We will not go back from that point unless maybe there is other health issues. So this will be our reference, and also we'll add a component of strengthening or anaerobic exercise. This is very important rehabilitation, mostly to chronic diseases like cardiovascular disease, respiratory disease. All are important to make sure we combine these components. But we are not doing this all together. We can follow these principles like walking exercise, 3 times a week, up to 5 or 7 days a week. and anaerobic together. The evidence says that this must be alternated. If today you are doing aerobics type of exercise, maybe walking regulation, and then tomorrow you skip to do the strengthening exercise using you have said like a very simple basic, maybe at home, the normal, like a bottle of water for strengthening the TheraBand. Very simple materials for strengthening. And this also must be having a baseline. At discharge, we take the one repetition maximum to know how much strengthening exercise we can give. If a patient can lift up 1 liter of water, then he or he cannot repeat again. So if that may be 3/4 liter or half a liter, then that will be a reference. So we will start a certain percent from the high percent. Maybe we'll take 40 to 60% of one repetition maximum. Then we'll start our strengthening exercise from there. This is just the addition, and then we have to make sure we are monitoring our patients. We check the vitals, the heart rate, oxygen saturations, any signs of fatigue you have said about RPE, rate of placebo